continue. So my name is Madison. I will be giving the presentation on the Best Practice Champions experience here at the Nipigon Hospital. So thank you everybody for joining this afternoon. It's a pleasure to be able to present on what we're doing here in Nipigon. First things first, I'll give a bit of an overview of our organization. So we are a 37-bed facility that provides long-term care and acute care to the residents of Nipigon, Red Rock, Herkit, Dorian, Beardmore, Lake Helen, and Rocky Bay First Nations. And I have a little map down below marked with a red X of our location. We have 15 long-term care beds, 6 chronic care beds, 1 short-stay respite, 15 acute care beds, and a 24-hour emergency department. We like to say that we're the jack of all trades here in Nipigon. We do a lot here. There are approximately 50 frontline nursing staff, including a mix of RNs, RPNs, and personal support workers. Other health professionals include a community support worker, dietitian, recreation therapist, and physiotherapy. Our hospital also provides placements to nursing students, PSW students, and medical students from the Northern Ontario School of Medicine. And we are an LCAP facility, which was sort of new to me. I just recently found out what this meant, and it means that we have long-term care beds in an acute care hospital. And there's me and my contact information. So just to give a brief bio, I've been a registered nurse for 5 years. I was born and raised in Red Rock, which is a small rural community in Northern Ontario, just outside of Nipigon and about 1 hour east of Thunder Bay. I graduated from Vancouver Island University in Nanaimo, BC, in June 2013 from the Bachelor of Science in Nursing program. After graduation, I stayed in Nanaimo for about 1 year working on an acute stroke unit before returning back home to Northern Ontario in 2014. And pretty much since then, I've been employed at Nipigon with a few short contracts at other places, one of them including Thunder Bay Regional Health Sciences Center as a medical float nurse. In January of this year is when I accepted the full-time nurse manager position, and as a part of my new role as the nurse manager, I became the RNAO long-term care liaison. So why did we become a best practice spotlight organization? Implementing the best practice guidelines will, for one, better support our patients and residents' experience and improve clinical outcomes. This venture with RNAO to become a BPSO has also provided professional development opportunities for our staff, including best practice guideline institutes and leadership opportunities through quality improvement initiatives. And Nipigon Hospital is also looking to further enhance the quality of services provided to both the residents and patients in the community. And RNAO best practices will be implemented organization-wide. So we're not only doing it on long-term care, we're also doing it in acute care and emergency as well. This diagram outlines our best practice spotlight reporting structures. So there's, if you sort of visualize it as myself, the liaison in the middle, and then these are all of the committees that we are working to implement guidelines on, and the 4 in black are part of our agreement with RNAO for the best practice spotlight. We haven't really established a steering committee, and part of the reason for this, I think, is because we're a small hospital. We don't have the numbers that the other facilities have, and so it's sort of the same people doing the same work anyway. So we're all, it's sort of an open communication, as that diagram indicates. This diagram shows our hospital's organizational reporting structure in regards to RNAO activities. So there's myself. I report to my chief nursing executive, we report to the senior team, and then fanning out from there, our quality committee, patient and family advisors, a board of directors, and then community partners. We have here at Nipigon a total of 17% of our permanent employees that are best practice champions, and this includes a mix of RNs, RPNs, PSWs, and allied health. We are always encouraging staff, especially new staff, to become best practice champions, and our senior management team supports the idea of best practice champions, and we will allow staff education days with pay to attend workshops or seminars. Considering our number of frontline staff, we think that 17% is a pretty good number. So what are the champions doing? They are leading implementation committees in pain, person and family-centered care, oral health, and constipation. They've completed gap analysis to see where they can make practice change recommendations. They are supporting implementation activities, so we recently had a one-year open house anniversary celebration where we recognized and honored our champions for the hard work that they're doing. The champions are making practice changes, they're revising and coming up with new policies, revising electronic charting systems, so Meditech and Medicare, to reflect best practices, and they're also doing monitoring and evaluation through the Enquire database. One of our strong committees is patient and family-centered care. So here at Nipigon Hospital, we've adopted a patient-resident-centered care philosophy that places the patient, resident, and family at the center of care. We involve our patients and residents in all aspects of planning and implementation of healthcare services. And we facilitate collaborative partnerships among our patients, residents, families, staff, physicians, professionals, and volunteers. And there's a little bit more, I'll let you read the slide there on our philosophy. But like I mentioned, one of our biggest successes has been the work that this committee has done. Some examples, we have established a patient, family, resident advisory council that meets quarterly. All staff have been trained in our clinical tactics of NOD, so name, occupation, do. We're currently developing new patient-centered whiteboards for patients' rooms. We've developed a pamphlet on our patient relations process for compliments, concerns, and complaints. We've developed a complaint process for long-term care, and there's also patient satisfaction surveys available for patients, residents, and their families. And I'll just show an example here on the next slide of the whiteboard that we're currently developing, and hopefully we'll get that out soon, and that'll be on acute care. Another committee that has done quite impressive work is that of the assessment and management of pain. The indicator that they're tracking in Enquire is the total number of clients who reported severe pain. The goal of this committee is to improve and maintain their patients and residents' optimal functional level and quality of life. So what they've done here is developed a hospital pain policy to optimally control pain for all patients. They want to reduce the incidence of unmanaged pain and ensure best practice interventions for patients with pain, and to monitor and track trends also related to pain management. So to do that, they're using comprehensive pain assessment tools, and this is one of them. There's a couple more on the next slide here. This committee is also engaging in audits to determine if appropriate assessments are being completed by staff. And one of the things they're hoping to get out in the near future is an educational pamphlet regarding pain to not only educate patients and their families, but also to educate staff. Another committee that I think is well-sustained and well-developed is our Palliative and End-of-Life Care Committee. Over the last 2 years, this committee has seen great accomplishments, including a grand opening of the fireside room. So there's some pictures there. We did some renovations to our palliative care room to make it more comfortable for patients and their families. We've developed an end-of-life admission order set, and we've received some funding from our local LHIN to hire a hospice bed coordinator to liaison with palliative care volunteers and community partners to ensure that the palliative patients have access to all services and supports at all times, whether they are an inpatient or out in the community. And we also have implemented the PPS, so the Palliative Performance Scale, organization-wide. So the nurses are using that on acute care, long-term care, and in the emerge. So after talking about our great successes, we have had some challenges while implementing our RNAO best practice guidelines. We had some turnover in leadership. As I mentioned, I started this position in January. So our previous nurse manager resigned, and she was the figurehead for the implementation of our best practice guidelines. I was new to management, so that involved some problem solving, big learning curve, mostly problem solving around how to get the staff engaged in best practice guideline implementation and committees, as well as brainstorming on how to revive the existing committees. Being a small organization, I think I talked about this a little bit, but we don't have the numbers, so we see the same people involved in the committees. The same people are doing all the work. We've seen a lack of staff engagement, especially in light of staffing crisis. We've been very short-staffed this summer, having to deny vacation. Many nurses are working extended tours and lots of overtime, so they're not really interested in extracurriculars since they are feeling overwhelmed and burnt out. Almost all of our frontline staff, well, not almost all, I should say half maybe, live out of town in the larger center of Thunder Bay, and so we find that they're not willing to commute on their days off for meetings. We've even lost a few staff to the commute as jobs have come up in the larger center. And we have multiple committees and meetings within the hospitals that the staff are already required to attend, such as occupational health and safety, staff meetings, quality meetings, and staff feel that they're being pulled in many directions. So we've only seen a few key people who show interest in the committees, and like I said, it becomes an issue of the same people always doing the work. So that's created some frustration. So here I'm showing some graphs on our absenteeism for acute care starting back in April of 2017 to present. So you can see, especially in the winter months, flu season, we've had a spike in our absenteeism, and then certainly leading into summer. And much can be said for the same on long-term care. The graphs pretty much mirror each other. So we've been dealing with a lot of challenges regarding absenteeism as well. So what do we do? Some solutions that we've come up with is doing one activity to meet multiple goals. So for example, with our Person Family-Centered Care Committee, you know, there's requirements there for accreditation and our hospital philosophy, quality improvement. So we try to tie it all together. We've involved our admin assistant to help with organizing meetings. We've tried to create alternative ways for the committees to meet, so email and OTN. We've even recruited staff through agency nursing. One of the things that we've noticed is that our nursing culture fears change because it can be difficult to break routine. and we also know there's a fear of increased workload. So we've tried to encourage committees to schedule their meetings on days that they're already scheduled to work, and of course, members who live out of town to phone in. The senior management team, especially myself and my chief nursing officer, have taken an active role in supporting additional paid nursing time to work on the implementation of these RNAO BPGs. And sustainability. So how are we going to keep this going? We're utilizing Surge Learning, so that's our software for dissemination of our education to all our staff. We use Meditech and Medicare for documenting and charting. The champions are making changes to different assessment tools on Meditech and Medicare. We have policies and renewals of policies and also revisions to sustain practice changes. We've tried to involve key resource people on the committees, so that might be the dietitian for maybe the constipation committee, pharmacists for the pain committee, palliative care coordinator, key people like that who we can access as resources. We've taken these initiatives organization-wide, which we hope will help to sustain the guidelines and the practice changes. And then we'll also plan for succession, so any further turnover in leadership. And I guess I sped through that pretty quickly, but that's it for me. I don't know if anybody has any questions or if they need clarification on anything. And then there's my contact information if something should come up later on.
Okay, awesome. Thank you, Madison. That was an excellent presentation, and you're definitely a small but mighty organization. I saw a lot of, I know that the challenges you experience is not unique to your organization. So I was just wondering whether other people on the line perhaps have any other tips for Madison in terms of how to be able to get through some of the barriers and challenges that she has experienced with regard to Champions engagement. Please feel free to chat, to type in the chat box any comments or any additional questions that you may have. While I give people time to think about that, I just wanted to point out some of the positive activities that you're definitely doing. One is that you have definitely listened to the stakeholders in terms of, and that is the staff with regard to what is burdening them and acknowledging that it is a very stressful time for them, especially with short staffing and the commuting and the realities of the workplace, and that you have really identified the barriers and facilitators and are trying to leverage and develop solutions to be able to overcome that. So, for example, aligning multiple projects so that if people are wearing multiple hats, there's an opportunity to be able to, hit one, more than one bird, like a bird with more than one stone. So that's an opportunity to, be more efficient. I do like the fact that also, there is the use of technology and alternative ways to be able to conduct meetings. I have heard most recently of, it is actually International BPSO, and I believe it's with one cohort where they actually connect through WhatsApp. So it provides people with the opportunity to connect with each other as needed, to be able to exchange ideas and to be able to, talk about Champions challenges and potential solutions on WhatsApp. So it's more of like an as-needed basis. Brenda says here the lunch and learns usually work well and for meetings as well. So that's a great idea. And I also do appreciate that you had taken the time to organize an open house. So RNAO has open houses, offers funding for open houses, and it's an opportunity for champions to be celebrated, to be given time to be able to celebrate what they've done, what they have done well, and to be able to recognize their work efforts. So perhaps maybe, Madison, you'd want to talk a bit more about what you did for your open house?
Okay, sure. The open house was really an opportunity to engage our community partners as well as staff and the residents' families in the work that we've been doing so far with our best practice committees, and just an opportunity to also honor the champions for their hard work that they've been doing. So I really wanted to recognize them as well, to sort of make it known to them that they are appreciated and that their hard work is acknowledged. And so we did purchase some stainless steel water bottles that say RNAO Best Practice Champion, and every champion got one. So just as a little token to show our appreciation. And really it was just, we had some cake and we celebrated, and it was a time for the staff to engage with the residents, and we involved our resident council, and the president cut the cake, and it was sort of really about just celebrating and sort of reviving things a little bit as well.
Oh, that's amazing. And how was the feedback from everyone?
The feedback was that it was overall a great event. I think the residents really loved it. We had about 20 residents come out. Yeah, and yeah, it was overall a very exciting event.
Oh, that's amazing. And is this something that you plan to organize on a yearly basis, or?
Yeah, I think it would be. I think it would be certainly a good idea for next year again to sort of have an open house and see again where we're at and how far we've come in a year's time.
For sure. Okay, that's great. That's great. I just given a few more moments for people to think about some of the challenges that perhaps that Madison had outlined that perhaps other people may have experienced in terms of champions engagement, wearing multiple hats, staffing crisis, changes in leadership. You know, all of those changes can be very stressful to people. And, you know, I can appreciate the need to just be able to get through your shift per se, and that, you know, potentially taking something else on is more than what could potentially add on to the stress. I have a question for you, Madison. And how has your home been able to move forward with best practice implementation in the face of lack of staffing and other challenges?
So one of the things certainly we've tried to make things exciting. So like I mentioned with the open house. Also, we've sort of the RNAO best practice guidelines has become a standing item on our agenda at staff meetings. So that's sort of another way where it's, you know, monthly, it's sort of brought up, it's something that's talked about, it's, you know, where are we at, and trying to keep it fresh, really, get it out there, get staff involved in any activities that are happening, any webinars or champions workshops that are coming up, just trying to always keep it fresh and on the minds of the staff. So the prompts, so the fact that this is part of, you know, everyday clinical practice, and it sounds like all of your BPGs have been spread across the organization? That's right, yeah.
Okay, so it's definitely in line with the organization's mission and vision, and it has become, you want to be able to create that evidence-based culture across the organization and be able to live it through these best practice guidelines.
Yes, absolutely.
Awesome, awesome. Just wondering if anyone had any questions, not only about the challenges it experienced, but also the specific BPGs that Madison had mentioned that they are implementing across the board. So one of them was a person family-centered care. The other one was the pain BPG. Just wondering if anyone had any comments or can relate or has also, you know, implementing that BPG in the organization.
Just a reminder, you can type it into the chat box and choose all participants.
So Madison, I do like with their person and family-centered care, the whiteboards I've seen being done as an intervention strategy in multiple organizations. And they are an effective way for patients to communicate with the staff and also for staff to communicate with each other. And you had said that you're going to be implementing that into practice soon?
Yes, yeah, we hope to.
Okay.
We put the whiteboards out to the staff to get an idea of what they thought would be valuable, and we also did bring the whiteboards to our patient family advisory committee.
Excellent.
Yeah, so that they had the opportunity as well to provide input on what they would like to see on those whiteboards.
Oh, excellent. So I'm just curious, compared to the healthcare provider perspective, what is it that residents were looking for that would be helpful for them on the whiteboards?
So they wanted to know who their nurse was, for sure. Mm-hmm. The date was important, what they like to be called, who was a part of their team, so and then also what was important too was a patient and family space, so somewhere where they could write down their care needs or any comments, priorities, or questions for, you know, when the interdisciplinary team came in for rounds.
Oh, excellent. And as with the other BPGs, the plan is to be able to measure the impact of these whiteboards you know, with the patients and their satisfaction, and also with healthcare providers?
Yeah, and so we do have our patient satisfaction surveys, and so that would be an opportunity to get any feedback, as well as when we meet quarterly with our patient advisors.
Yes. I really like the fact that, you know, you're really providing a formal forum for patients and families to have a voice in the development of these interventions and what really would resonate with them as the receivers of the care. So I've seen that also in other organizations, and I think that's just really great. So congratulations. There is a question here.
I see that, yeah.
Yes, we want to know what kind of activities the champion do on their units department to keep their colleague engaged in BPG practices.
That's a good question. And also too, I'm looking for ideas actually of activities, because I don't think that our champions are that as engaged as they could be on the unit. So, yeah, I guess if we can open that one up to the floor for ideas, that's certainly something that that we need to work on here in Nipigon, is getting our champions to engage the rest of their colleagues, and that certainly has been a challenge just with you know, the staffing crisis and everything else that has been going on. So, yeah, I would say, you've got another question.
No, this is awesome. Oh, well, Denise says, try leading by example. I think that's very true. If you have, champions and you might have only a small number, obviously champions can be very persuasive practice leaders and be very motivating. So there's a power in the social influence and by leading by example. So that sounds like a good example.
I will say we have had lunch and learns. Our palliative committee, one of our sort of stronger committees, I guess, has had lots of lunch and learns.
Okay.
And that has been that's been led by a champion, and that has been engaging for staff.
Okay.
So I will say that has worked actually.
Okay. So the peer-to-peer to support and peer-to-peer like education.
Right.
And has there been food?
Yes, we served lunch.
Yeah.
One of the things though about that committee is that they have received funding, and so so certainly that helps, right? If there's food attracts people. So the other committees, I don't know, maybe fundraising might be something that they want to look into to have lunch and learns, but certainly, yes, lunch and learns have worked well for our palliative care committee.
Oh, excellent. Is there any, you say they're one of the stronger teams, are there any, anything else that perhaps they've done differently that other teams haven't tried out yet?
I think it's the champion and her passion.
Yeah.
For what she's doing, and she's a keener. That's been part of it.
Yeah.
Yeah.
Very influential when you have someone who's got a lot of energy and it puts out a lot of energy.
Right.
Awesome. There is another follow-up question. How do the staff accept BPG into their day-to-day work? Do they find it helpful?
I'm not sure. So how are they, I'm just not sure I understand the question. How are they?
I guess and I'm to this person, please clarify me if I'm misinterpreting, but when you introduce new practices or change, and you had said yourself that there's sometimes resistance to change, and so how are you, if BPGs is something that is spread across the organization, and how do they how do they come to, after the initial resistance, have they come to accept BPG in their day-to-day work, or is that their continued resistance? Have they find value in the best practices?
I would say, and this is just being completely honest, that there is continued resistance. Yeah, and we have a few keeners really who they want to be up to date. They want to get the work done that their committee has outlined and set goals to achieve. But mostly there's been resistance, and that again falls back to our staffing challenges and I think our small number of staff and that answers the question. Yeah.
The person who asked the question, and that was exactly that she was looking for in terms of question. I wonder with the evaluation results that you get, whether you show it, whether there's, you show it to the staff as a way to say, hey, because you're integrating these best practices, you're actually, your efforts are resulting in positive changes, whether it's in patient satisfaction or pain scores or whatever it may be. Is there a forum to be able to share back those results as a means of motivating staff?
I think we can certainly discuss that at our staff meetings, where we catch a larger number of staff and post in the minutes, which gets emailed out to everybody. And
Yeah, I'm just thinking because you definitely you and your team, your organization is doing a lot of work, and that is to be commended. I mean, I think you do have a critical mass of champions. 70% in the face of the challenges that you experience is amazing, and you're obviously a strong leader and very cognizant of wanting to meet the champion's needs and being thoughtful about the challenges they experience. I do have a question from Terry Holland. She says, with regard to your pain BPBG, have you been able to engage any community partners related to chronic pain and opioid use?
That is a goal of the committee, but I don't believe that's happened yet.
Okay.
That's on one of their goals in their gap analysis.
Oh, excellent, excellent. Any preliminary strategies that perhaps you can share, or any plans that you're planning to implement, or is it very much still in the discussion phase?
It's in discussion phase. Right now, the big focus of the committee is that they've started to collect data on pain intensity, and they're focusing on our staff using the right tools to assess pain, and are the residents understanding the tools, and so that's sort of been their major focus right now.
Okay, so working internally in the organization and perhaps spreading out and being able to thoughtfully engage your community partners in a strategic way.
Correct.
Well, I think that it's a major, great first step in terms of inviting your partners, community partners, to an open house in order to be able to say, hey, this is the great work that we're doing, and to be able to keep them informed and keep them engaged in that way. So I think that's been great. Terry Holland has a follow-up question. Have you been able to explore additional or specific funding related to opioid use?
No. I would say no. We're still focusing internally, but that's good. That's a good question, and that's something certainly that I will bring forward to the committee. Okay, great,
great. Do people have any other questions? Great questions here. With regard to your BPG activities and to champions engagement. So this is definitely information that we can learn here at RNAO from other people and for others to be able to learn as well. So thank you very much for sharing. Any other questions or comments or anything that you want to know a bit more about from Madison?
I would certainly be interested in hearing what champions are doing at other organizations, and maybe if anybody has any solutions to some of the challenges that I'm facing. I don't know. I can just put that out there.
Yeah,
anybody has any comments?
It is, again, something that is very challenging, and as I had said, I think a lot of organizations experience in this day and age. So what are other champions doing at your other at your workplaces? There has been, with regard to some of your challenges, I do have a story from another BPSO, one where there was a big amalgamation and it was very stressful for people. So they actually rejigged their priorities and decided to implement, look into implementing, at first identifying what healthy work environment type issues they can address and implementing one of the healthy work environment BPGs. So they really focus on the self-care of the staff and to develop the relationships and nurture the staff in that way to be able to get them through a very difficult time And because of that, and because we're able to, again, be able to focus on self and perhaps, garner more resources, then, that acts as leverage to, start to implement other BPGs when that, after that. That was just one story. HRH is just starting. We are at the stage of having champion educational sessions. So, again, at the very beginning, and you have to be able to start somewhere, and it starts with, what does it mean to be a champion? So I'm sure, Madison, you remember those days, and it continues on with you recruiting additional champions?
Mm-hmm.
Yeah. In terms of maybe some tips for HRH, since they're just starting, once you train the champions, what did you do in terms of onboarding afterwards? And in terms of, the what next for them? How did you end up, developing, for example, a strong palliative care team with regard to the implementation of that BPG?
I think, again, that committee is so strong because of the passion that some of the members have for the committee. Mm-hmm. But also, they have a really good way of just making things fun and getting together and fundraising. So their goals, setting goals, and they've had some great success with also funding that they've received. So applying for funding and that sort of thing. Mm-hmm.
So definitely great points that you bring up is that they were creative, they made it fun. Definitely funding support is great to have, because then you're able to protect time or be able to develop resources for your staff, and the fact that that team continues to engage, as you said, through lunch and learns and through providing food in that time to be able to for professional development.
Right.
Definitely. The person who at HRH said we were hoping to create activities for champions to disseminate information. So is that one of the roles that also your champions at your organization had, especially when they started?
I think so. Our open house, for sure. That was one activity that this is our second year we've done it. They had a bit of an open house last year as well. So involving the champions in the planning of those types of events certainly helped to disseminate information, for sure.
Oh, awesome. Great. Great comments and great questions, everyone. I really appreciate it. If anyone has any other questions or any other, strategies you'd like to be able to bounce off Madison, or just share about what, as Madison has said, what other champions are doing at other organizations. We could always learn from each other. Please feel free to type in the chat box, and so we can all see your comments or questions. There is one additional question here that I see personally in my box. What have you found to be the most important ways to sustain best practices in a small long-term care home or unit?
So one of the most important ways is sort of aligning our best practices in our strategic plan for our organization, as well as involving key resource people, which I touched on briefly. So utilizing those resources, such as dietitians, sort of the experts in their field. So the dietitian, our pharmacists, our regional pharmacists, and then as well implementing these best practices organization-wide. So not only long-term care, but throughout the organization.
And you are in a unique organization in that there's long-term care, acute care, there's ER,
right.
so definitely how the BPGs are implemented in these different settings is going to play out differently.
That's right.
I'd say that's an exciting challenge.
Yeah, at the same time, yes, it has been, it has created a bit of a challenge, but it's something that our organization and these units are just so interconnected that it just felt right.
Excellent.
To do this organization-wide, so.
Oh, excellent. No, that's really good. And, you know, the BPGs don't only apply to the long-term care portion of your hospital. It is, pain, person and family-centered care, palliative care, can happen in any or in healthcare setting, and I suppose it's an opportunity for champions within those different care settings to come together to say, how can we tailor this to our setting?
For sure.
Because definitely. Okay. Well, thank you very much, Madison, for that presentation and for the questions, everyone, that you're able to generate or comments. I really appreciate it. Again, as I said, it's an opportunity for all of us as champions to be able to network and to share each other's solutions and perhaps strategize and brainstorm together. So I really hope that this is a forum for you to be able to do that. I'm just going to start to close. And Madison, thank you very much for also offering to provide your contact information and for your willingness to be able to share additional information should anyone want to reach out to you. So really appreciate it, and congratulations on such a great job well done in the face of your challenges. I think there's a lot to celebrate and a lot of good work that's being done. So thank you very much for sharing.
Great, my pleasure. Thank you.
You're welcome. I'm just going to now move the ball so that I can. Madison, would you be able to, yes. Oops, sorry, I'm going to pass the ball to myself. Okay. So I'm just going to close by, where is my, close with the closing slide here. So just to let everyone know, in case, and I know there has been some audio difficulties, but thank you for bearing with us and for staying online. The copy of today's presentation and video recording will be posted on the RNAO website for those individuals who want to be able to listen to it. Please fill out this evaluation survey. We're always interested in learning how we can improve on these networking opportunities and other topics that you may be interested in. And if you have any questions, please contact Andrea Stubbs. She is the project lead of the Champions program, and her email is online at astubbs@rnao.ca. Otherwise, thank you very much for presenting, Madison, and thank you very much, everyone, for attending. And I hope everyone has a great afternoon. Bye-bye.